After an injury, special care must be taken to keep your skin strong and prevent any pressure injuries from developing. This video will demonstrate how padding and positioning used with a proper turning schedule will help prevent pressure injuries. Bony areas of the body that are more at risk for pressure injuries include the back of the head, ears, shoulder blades, shoulders, elbows, hips, tailbone, ischial or sit bones, knees, ankles, heels, and toes. It is also important to know that your weight has a role in the risk of a pressure injury. If a person is overweight, there is more pressure on the skin and tissues where the bony areas of the body come in contact with the surface of a bed. A person who is underweight is also at risk. The layers of skin and tissue on bony areas of the body may be thinner and may not offer enough protection. Now, you need to know how to protect those areas. When placing pillows, always keep in mind to pad around bony areas to relieve pressure. There are several things you can use to pad yourself. Recommended materials for padding include bed surfaces, pillows, foam pads, wedges, padded boots, ankle pads, and specialized bed surfaces. What you use for padding depends on how much you can pad for yourself. When lying on your back, the back of your head, shoulder blades, elbows, tailbone, and heels will need to be protected. If you have or are at risk for pressure on your tailbone, lying on your back is not recommended. Place a pillow under your head. Place a pillow under your calves and above the heels so that your heels are off the bed. Place another pillow at the bottom of the feet to keep a 90-degree angle at the ankle. You may also want to use foam pads if you need extra support. Another option is to wear padded boots in bed. You can also put a pad or pillow between the knees and ankles if they are too close together. If needed, place pillows under your elbows. For people with skin problems on their tailbone, you may need to pad above and below your tailbone. When lying on your side, pads should be placed at your head, ears, shoulders, hips, knees, and ankles. Do not place padding behind or under your buttocks. This will add more pressure to the tailbone. Use pillows to pad elbows and arms for comfort. Lying on your side is only helpful if your tailbone is completely off the bed. When lying on your side, the more you can move the top leg over, the less padding you may need to use. Some people prefer lying on their stomach. Be sure to check with your healthcare provider first. There are still areas at risk for pressure in this position. Your shoulders, hips, knees, and toes will all need to be protected. Pads above and below the hip bones can be useful to relieve pressure on a suprapubic catheter. If this is a position that you are going to use often, be sure to get proper training on your specific padding needs. Always make sure you are not lying on any tubes or equipment. Always remember, proper positioning is essential to the effectiveness of the padding you use. Padding does not take away the need to turn. It is important to maintain a proper turning schedule when lying in bed. Padding in bed is one way you can prevent skin breakdown and keep your skin healthy. It is important that you and your caregivers understand how to pad properly and comfortably. Remember, care of your skin is a big responsibility and a very important one.